Hello, everyone. Dr. Breanne Kallonen here, naturopathic and functional medicine doctor, and I wanted to share a patient case, which this patient came in with some significant hair loss and no answers for why she was experiencing this hair loss. It was diffuse all over. She really didn't know what was going on. So in my practice, I run a comprehensive hair loss panel. This is a blood panel. You can order this on your own through Rupa Health. It's linked in my profile. You'll be able to find that as well. It's linked in the bottom of the comments of this video. Running the blood work truly does provide us with answers with respect to what is going to be the most favorable treatment plan for each and every individual. Now, this panel looks at hormones, inflammation, nutrient levels. It also has a look at things like insulin resistance, which can lead to hair loss. So we're going to go through this individual's results really quickly here so you can get an idea of what this panel could provide information with respect to your health if you are struggling with hair loss. Now, there also is another test called the Tricho test. This is a DNA test. Best case scenario, I do like to combine the DNA test with the blood test results because the DNA test can tell us what your genetic predisposition is. The DNA test can also tell us and predict what is going to be your response to treatment, whether it's nutrient supplementation, anti-androgens, pharmaceutical supplements, nutrient changes based off of your DNA. Now, of course, you can change the way your genes are expressed with your lifestyle. Maybe genetically you're at risk of low vitamin D, but because you've either been supplementing or in a sunny environment, your blood work shows your vitamin D is fine, and then you don't need to supplement. That's why I like best case scenario to combine the two. Now, the best part about the genetics is, of course, your genes don't change, so you don't have to repeat that testing. Whereas the blood work, you would repeat it. We may implement some treatment options for you, as well as we would want to repeat the blood test usually within 3 months, depending on what we are targeting. Now, for this particular individual, you can see right off the bat that her iron is low. For individuals who are having hair loss, I like to run a full anemia panel looking at the iron, the percent iron saturation, as well as the ferritin levels. Now, ferritin tells us about the stored amount of iron, and many individuals get a ferritin done, and that is great. But if you have inflammation, ferritin can be artificially elevated. So that's why ferritin may or may not always be the best marker for measuring progress and iron deficiency. Right now, what's on my screen is a summary of the out of range levels. So the iron's out of range, the iron saturation's low, the vitamin D is low. Vitamin D is also really important for hair loss, and the zinc is low. Now, these are often markers that are not being investigated on routine testing. So this is why the comprehensive approach is really important. Now, do we just supplement her with these things? Yeah, she can benefit from supplementing, but we also want to ask the question, why are these levels low? So with respect to conversation with this individual, she does have some digestive upset concerns as well. So we are actually going to be running her celiac panel. We're going to be having a look at if she's genetically at increased risk of celiac, as well as what her tissue transcontaminase are. She does have an autoimmune increased risk because there's autoimmune conditions in her family. So we're also going to be adding on an ANA at her next blood draw. Now, other things that we had to look at was her blood sugar and her blood sugar management. We know that elevated blood sugar, or having an elevated hemoglobin A1C, which is the average, 3-month average of your blood sugar, having that elevated, as well as insulin resistance, can cause some hair loss on the head. But for this individual, I don't think that's not the issue for her. Her hemoglobin A1C was fantastic. 5.0, 5.1, 5.2 is great. Anything above 5.5 does put you at risk of prediabetes, so I never like to see it above 5.5. Her insulin, I think her insulin is absolutely optimal. So this is not an insulin resistance case, which is quite interesting. Her B12 is greater than 500, which is where I like to see it. So that's great. Her ferritin is also low, right? So this is a huge range for the ferritin, 7 to 270. This is a massively broad range. I like to see ferritin at least 80 for hair growth. So this is where we have to pay attention. Just because something's normal or more common doesn't mean it's optimal. So we definitely need to look at ways that we're going to increase our iron. And there's various different forms of iron according to the CDC guidelines, if you are not pregnant, you want about 50 to 60 milligrams of elemental iron. And there are some supplements that are easier on the digestive tract versus others, and we can discuss that in our patient visit. There also is some interesting thought about dosing. When we're looking at giving these higher doses, 50 to 60 milligrams elemental iron orally twice a day per the CDC guidelines, sometimes when we give those higher dosages, individuals tend to have a harder time absorbing the iron for 24 hours after. So a strategy could be, when we're repeating this blood work, if this individual is not absorbing, we may do alternate day dosaging. And that's another important thing, that we have to make it work for you, and we need to repeat this blood work. So I typically like to make it easy for individuals, and we do the 50 to 60 milligrams oral elemental iron twice a day. And you can get that from various different forms of iron. And then we repeat the blood work in 3 months' time. If we're still not absorbing it, then you may need to do the alternate day dosaging of the iron. But again, we can supplement so we can preserve the hair, so we can make this individual feel better. But again, we need to ask the question, why are these nutrients all low? If she's not consuming the nutrients in her diet, we need to look at that. But we also need to rule out celiac disease as a potential concerning factor. If celiac disease is not there, the ANA is fine, she's not genetically more prone to celiac disease, then we may want to also investigate gut infections. And for that, we would do a stool test. So again, a comprehensive look. Her cholesterol panel was fine. No worries with the triglycerides, the LDL, like her cholesterol looks absolutely amazing. Vitamin D is low, and we have to ask the question, is this because you're just not getting sunlight? Or again, we can see lower amounts of vitamin D with celiac as well as leaky gut. Her thyroid testing. Now, the thyroid testing, TSH tells us, is the brain communicating with the thyroid gland. Her brain's not yelling, that looks fine. I like to see it under 2.5. Her T3 and T4, I do think her free T3 is a little bit on the lower end, but do we jump to a prescription medication? Well, we know low iron, low vitamin D, low zinc. She's probably low in other nutrients as well, like vitamin A. Those are all really important for thyroid function. So first we need to figure out, how do we give the body the nutrients that it needs so the thyroid can function on its own? She does not have an autoimmune thyroid condition because the antibodies are low. The reverse T3, I like the reverse T3 to be under 12, under 10. Reverse T3 essentially is very similar to T3. They look similar. They can both fit in the binding site of the cell, but the T3 activates and turns it on, where the reverse T3 just clogs it up. So this is a problem because she's got a little bit lower of her active thyroid hormone, and then the reverse T3 is binding up the receptor site. Again, we can monitor this and see how things are doing, but I don't think that this is contributing to the hair loss. I think this thyroid not being optimal is subsequent to the fact that she has a lot of other lower nutrients that we need to supplement with and figure out why. Now, in terms of her hormones, so my recommendations for individuals doing the hair loss panel, because we are measuring a progesterone, is to go do the testing 7 to 10 days before your next expected period. Now, when I see a progesterone low like this, really, she should be in the luteal phase. It should be higher if she truly did it 7 to 10 days before her menstrual cycle. So either she didn't ovulate or we tested too soon. So I need to follow up with this patient and say, okay, when did your period come in relation to the date that you did this test, in order to accurately understand this? Many doctors will say there's no point in testing hormones, especially in females. They change all the time. They change day by day. Yes, your hormones do change day by day, but we have reference ranges depending on where you are in your cycle. So as long as we know that information, we can properly assess this. Now, hormones, I would first clarify with this patient when she went, and not look at the estrogen and progesterone. More, the hair loss is coming from the nutrient levels. We can go back and look at the hormones after, of course, but I don't think they're the primary cause. Other things for women who have more of that classic androgenic alopecia, so losing the hair kind of at the base here, the top of the head, in and around the hairline. Sometimes this can be due to elevated androgens. like DHEA, like dihydrotestosterone or DHT, testosterone as well, androstenedione. And a lot of females are just kind of given spironolactone, which is an anti-androgen. It lowers those androgens when they haven't even been tested to see. This patient is not going to have a favorable response if that was the solution for her, because her androgens look fine. Her DHT is not high, her DHEA is not high, her testosterone is completely fine. And in fact, lowering these even more, she would start to experience symptoms of low testosterone, which we don't want. Her cortisol levels first thing in the morning looked fine. Now, I always tell individuals this is just a snapshot in time. It doesn't tell us about where your cortisol levels were at the end of the day. It's just the exact moment they did a blood draw. So if she is feeling stressed, working on stress management will be particularly helpful. Her RBC magnesium looked fine, more or less. It's a little bit on the lower end. And of course, the red blood cell zinc was low. So there we have it. We were able to come up with a treatment plan for this patient. We are going to supplement her with therapeutic levels based off of her labs. And then we are going to run a celiac panel and an ANA to see if there's any autoimmune issues. And is there celiac? Is there leaky gut? And investigate that. In 3 months' time after supplementing, we are going to repeat the labs to make sure that things are moving in the right direction. That's the hardest part, right? If you're taking something, you want to know that it's working. So having that repeat blood testing scheduled is really important so that we know we're moving in the right direction. I hope that was helpful for you. If you want to order your own blood work to assess the root cause of your hair loss, I'm going to link that below. And as well, pairing this blood work with the TRICO test, the genetic test for hair loss, is the best of the best solution to find exactly what's going to work for you and in the fastest way possible. Of course, when it comes to hair loss, time is everything. A lot of treatment options, we want patients to be utilizing them for 6 to 12 weeks before we assess if they're working or not. And of course, when you're losing your hair, you don't want to wait around 3 months to figure out if a treatment's going to work for you or not, because the more time that you're wasting, more hair that you're losing as well. So I hope that was helpful for you. Any questions or concerns, please let me know and we'll talk soon.